Hi, I'm Brittany, a neurodivergent mum and speech pathologist. This is Not Just Theories, where I share what actually works in my real, messy life. Because life doesn't follow a theory. Here's what I actually do. Hi everyone, and welcome back to Not Just Theories. I'm Brittany, and today I'm going to be talking about advocacy. So this is a topic that comes up a lot in my work and also in my own parenting journey. When I'm talking about advocacy, I'm not talking necessarily about being loud or confrontational. And to be an advocate, you do not need to know exactly the right thing to say in the moment. To be an advocate, what you need to do is it's ongoing, exhausting, and quiet work of noticing if something's not feeling right, asking questions, coming back again, and trusting yourself enough to keep going even when you're told to wait. So this episode is especially for neurodivergent parents because advocacy can cost us a lot more energy and we're already running a bit low, but it is for all parents because all parents will at some point in time have to advocate on behalf of their child. So advocacy is hard for lots of parents. And for those of us who struggle to process information in real time or find authority figures intimidating, we might be someone who second guesses ourselves constantly or replays our conversations afterwards, thinking, I should have said this. And for some of us who shut down when we feel dismissed, advocacy is particularly hard. Adding in sleep deprivation, postpartum hormones, and the emotional weight of being one of the people who cares the most deeply about your child. But asking that follow-up question just feels so enormous when you've got all of those things going on. On top of that, if you're neurodivergent, you may have had a lifetime of being told that you're too sensitive or that you're overthinking or catastrophizing or that you're hypervigilant. So if a professional says, let's just wait and see, it can really hit an old wound of like, maybe I am imagining this. Maybe it's all in my head. Maybe it isn't the way that I see it. Maybe my view is wrong. So I'm going to share something personal here. Even as a paediatric speech pathologist, it was so hard for me to advocate for my eldest child. Because even when I noticed a few things going on, some speech and language differences, very extremely disrupted sleep, and signs of sleep disordered breathing, even though none of those things were dramatic or emergencies, my gut was saying something's not right. And the responses I got were like, let's just wait and see, or she'll grow out of it. That's within normal limits. And you're probably noticing more because of your job. And that last one was probably the one that hurt the most because these were things that I was noticing because of my job. But that didn't mean I was wrong. It just meant that I was able to see subtle language and speech sound differences more than another parent would have because I knew the milestones. I knew them really intimately. I'd seen so many children the same age, and I could see my child's underlying capacity in nonverbal language and how it wasn't matching up to her verbal skills. And sure, if I wasn't a speech pathologist, it might have taken me a lot longer to notice those differences. But being a speech pathologist and noticing them when they were subtle doesn't mean they weren't there. And it took months. To be honest, it actually took a year and a half. Multiple appointments, multiple attempts, multiple professionals, GP, pediatrician, all sorts of things, and a lot of self-doubt. And eventually we got a referral to an ENT. And you know what we found? She had hearing loss and she needed grommets or tube surgery if you're in the US. And she also had enlarged adenoids, which contributed to sleep disordered breathing, which needed surgical removal. So those small signs that we'd been seeing for 18 months, her whole life, they mattered. And she needed surgery. So this isn't about me being right and those professionals being wrong, because I might have gotten that referral to the ENT and nothing had been wrong. That's fine. But even the amount I had to advocate to get the referral was too much. It's not a system that's set up for parents to be able to navigate easily. I am a health professional. I am a health professional who works in the area of speech and language in kids aged 0 to 6. And I still had GPs telling me to wait and see when my child was demonstrating clear speech and language delays, still telling me to wait to get hearing tests done, still telling me to wait to see an ENT. And I pushed back as hard as I could, and it still took me a lot of attempts to get it. If I hadn't had that professional knowledge, I am so sure I would have given up, and I wouldn't have sorted out that hearing, and I wouldn't have sorted out that sleep disordered breathing until she was so much older, because it would have persisted without surgery. These are things that persist. And who knows how much further behind she would have gotten if I hadn't been able to get that treatment that she needed. So I know how hard it can be to be heard, even with the confidence that I had from knowing I was right and knowing what I was looking at. And I still nearly didn't persist in advocating once I'd had a couple of rebuttals. So that's why I'm really passionate about this topic, because parents do know their children best. And getting a referral onwards to the professional who specializes in an area, if you think that that's the area that your child is struggling with, is so important. If that professional then says everything's fine or wait and see, and you still think it's a problem, you might need to advocate for a second referral. But sometimes the reassurance of knowing that there's an actual, person who is in an area of specialty, having eyes on your child makes so much difference. And having GPs or general practitioners, that you can be amazing. You can have amazing GPs, but they are not child development specialists. They're not speech pathologists. They're not ENTs. They're not occupational therapists. And if you've got concerns about your child, having them progress to at least that next level where you're having a phone call or the face-to-face session with someone whose area of specialty it is so important, because a wait-and-see approach just isn't actually what always needs to happen. So professionally, I know I've had parents come in with 3 or 4-year-old children, and when I ask them why they're concerned or when the concern started, so often the answer is, I was concerned when they were 1, when they were 1.5, or when they were 2, and we were told to wait and see, and they haven't grown out of it, so now we're being referred. My service has a 12-month wait for therapy at the moment. We see children immediately for an assessment, but then they go on a list to wait for therapy. And if those parents had referred when they'd first been concerned, they would have already been in and up at the top of that list for therapy. And instead they have to wait a whole year. And that 4-year-old is then 5 and going to school. And that parent's been concerned since they were 1 year old. And other professionals told them to wait and see. And then they get into the community health system and there's another wait for therapy. And even if you're not going through community health, if you're going to private practice, there's still often a wait. Speech pathologists are an area that is currently under a lot of demand in the Australian landscape. And there can be really long wait lists, especially depending on where you're located, even to get in privately when you're willing to pay for it. So waiting to see before you even get the referral is just this increase in risk, and it delays everything. And we know early intervention is so important. So why are there still people out there advocating for parents to wait and see or pushing back when parents have concerns? It's something that really concerns me as a speech pathologist, that people whose area of specialty is not speech and language development are the ones giving out advice for parents not to see a speech pathologist yet. If you are concerned about an area of your child's development, it's really important to see the person whose job it is to assess that really specific area. At least getting some advice from someone who can tell you when to be concerned or when to progress that concern. So I'm going to talk a little bit more now about advocacy, because I think it's quite easy to think, well, some people are just good advocates and it's like a personality trait. And I think it's true that there are some people who it comes much more naturally to, but advocacy is a skill. It is something that you can practice, because it's not about arguing or demanding or having perfect words. What it's about is noticing patterns, asking for clarification, following up, requesting reassessment, and coming back if something still hasn't been resolved. So it's that coming back and persistence until the issue or concern that you've noticed has been addressed. What it doesn't require is any certainty, because you're not expected to be a health professional. You are not expected to be an expert in child development. What you're expected to do is notice when you have concerns about your own child. You are the person who knows your child best other than themselves, and it does not require you to be certain that there is an issue. It only requires you to have concern and say, I'm worried. And you don't need to prove something's wrong. You just have to say, I'm still worried. Some things that can make it easier to advocate for your child are to notice those patterns rather than individual moments, because one-off things are much easier to dismiss. So even though those one-off things might be important, they're more likely to be dismissed when you go into your GP appointment. Patterns are a lot harder to ignore. So instead of just saying, oh, she snores sometimes, you say something like, oh, she snores most nights. She's snored 6 out of the last 7 nights and she wakes up tired. Or instead of saying, oh, I think his speech might be a bit unclear, saying, what's the effect of that? Saying people that he doesn't know struggle to understand him. And it hasn't improved over time. So you're not needing perfect data, but just notes and talking about the impact on your child, not just what you're concerned about. So instead of, oh, she snores, it's she snores and wakes up tired. Or instead of speech being unclear, it's hard for people to understand him and it hasn't improved over time. So multiple impacts on your child are going to be less likely to be dismissed. So take some notes in with you. Another thing is not necessarily having a script, but having an idea of like a sentence that you're going to say if you feel like you're being dismissed. So these might be things like, I know this can be normal, but I am still concerned. Can you help me understand why we're not investigating it further? This has not improved with time. Why are we still waiting? Or what would tell us that waiting is no longer appropriate? So write that sentence down, bring it with you. Use it if your mind goes blank when that professional tells you no or to wait and see. Being prepared for that. If you are told to wait, something that you could do is to ask what the next step is. So that might be something like saying, how long should we wait? What signs mean we should come back sooner? Who do I follow up with if this continues? So if you are told to wait, try not to see that waiting as a dismissal, but turn it instead into a concrete plan. So if you're being told to wait and see, try not to leave that appointment without like a specific plan of when you are coming back if the concern persists. When would it be appropriate to come back sooner than that plan? What might happen? And that idea of who, like, do you come back to the same doctor if it continues, or if it continues for the next 3 months, is the plan for you to just call up that next professional yourself? Do you need a referral? Can you do it yourself? You're also allowed to borrow authority from other people. So when you're coming into these appointments, is there anyone else who might have noticed patterns in your child that you can refer to? So it's not just a parent saying, hey, I'm concerned, but you can say, oh, this has also been noticed by his teacher in school. Or you could say, oh, our speech pathologist mentioned this might be worth checking. Or you could say, childcare has raised concerns about my child's sleep. So you're not name dropping, but what you are doing is you're providing extra context for your health professional that other people are also noticing it, and that you're not just doing it yourself. Even though you doing it yourself is perfectly appropriate, if there is somebody else who's noticed the same concern, make sure that you mention that, because it might make you less likely to be dismissed. And another thing to remember is that seeking another opinion is not disloyal. So it doesn't mean you don't trust your provider or that you're being dramatic or difficult. It just means that for this particular issue, you needed a second opinion. And any provider who's not comfortable with you seeking a second opinion, that would be so unprofessional. It is normal for parents to need a second opinion, particularly for big issues or big concerns. And it's okay to look out for that. It's okay to go to a different GP to who you normally see if your first dismissed you. Another thing I want to talk about is the emotional side of advocacy, because it can be so tiring, because advocacy involves, pushing past your self-doubt and managing your own emotional reaction, especially if you are being dismissed and you're having to fight through it. It means revisiting worries that you may actually rather ignore. Acknowledging that there's a concern or a problem can be really hard in and of itself, as well as just all that mental load that you're carrying by being the person who's noticed those patterns. So if you need a break from advocating, that is okay. There are some people out there whose job is to be a professional advocate. If you are applying for the NDIS in Australia or the ECEI, the Early Childhood sub-branch of the NDIS, there are people out there whose job it is to help you advocate for your child or for yourself when you're applying for that source of funding. It is a paid service. Not everyone can afford it, unfortunately, but it is out there. And for some people, having an external advocate can be really, really helpful. But also you need to remember advocacy doesn't have to be constant to be effective. It can be planting a seed, taking that pause and coming back when you've got a little bit more capacity. So coming in for, rather than, wait and see for 12 months, can you go in, raise your concerns, and then go home, take note of everything that is relevant to that concern for the next 4 weeks or 6 weeks, and then go back again with extra information to that same doctor who's already had that idea planted that you are concerned. And then when you come back with more evidence, that might sort of get you over the line to getting the referral that you need. Can just be something to keep in mind, especially if you've left an appointment. I know it's really hard when you leave an appointment and you might be quite disappointed about being dismissed. It can be really hard to go and see a doctor in the first place and raise a concern, and to go to all of that effort and have it go to nothing can be so exhausting. But then thinking, what are the next steps from there? Is it going to get a second opinion from somebody else? Is it better to start fresh? Or is going back to that same doctor again, armed with a little bit more evidence of your concern, whether it's a video of the snoring or, a video of the unclear speech or whatever the concern is? Can you get video or written evidence to bring in the next time to that doctor who's already had it flagged as a concern? So you might choose one of those two different paths depending on your relationship with your provider, but either is okay. For those of you who might be worried that you're overreacting, I want to say really, really clearly, you are allowed to trust your instincts without being 100% certain. You are allowed to ask again. You are allowed to say that this still doesn't feel right. And you're allowed to do all that advocacy and then be wrong without being ashamed. Because advocating and being concerned doesn't mean something must be wrong. What it means is that there's something that needs to be checked. The best case scenario is that you advocate for your child, you get to the place that you need to be to have that concern addressed, and you're given either clear understanding of what the concern is and what can be done, what the concern might be and when to come back with a really clear plan of a time frame, or reassurance, which is also really valuable. So I have it happen all the time at work. Parents come in and I get to tell them this is considered typical development. But if you're still concerned at this age, or if these skills haven't been mastered by this age, that's when I want you to come back. And so you're able to send parents away with a clear understanding of the next steps. And then they're not just worrying for the next 6 months about their child's speech. They have a really clear plan of, okay, well, I know that what they were doing at that 2-year check with the speech pathologist was okay. They weren't expected to say those sounds clearly at that point. If they still can't say those sounds when they're 3 years old, I need to go back, and I have a clear plan about that. Or they might come in and, yes, need therapy, and then they're able to start going through that process of, is there a wait list for therapy? Is there funding they need to be applying for? And that journey can start. So I think it's really important to know that it is okay to go to that next step and then have everything be okay. It's better to do that almost all of the time. It's better to do that than to not escalate if you've got concerns, All of this is even more important in like a hospital or emergency situation. If you're concerned about your child being imminently unwell and you're feeling like you're being dismissed, this advocacy is even more important, because we know every year there are children who are very sick, whose needs are dismissed, and they're sent home from hospital, and then they have to represent the next day because they've deteriorated, or even poorer outcomes can happen really sadly. So advocacy, asking for a clear plan, when do I come back, at what point does this need to be escalated, all of these questions will help you either know when to take that next step or know when you can be reassured. So please, 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 any concerns you have, do your best to get those concerns put in front of the person whose opinion on those issues is the most relevant. And usually, not always, but usually that means trying to get the referral to the specific health professional rather than seeing a generalist. If your generalist can really concretely tell you what that typical development is and when to be concerned, that might be okay. So if they've got a handout from Speech Pathology Australia with some of the communication milestones, and the thing you were concerned about is really clearly labelled under a different or an older age group than your child falls into, that might be enough reassurance for you, and that's okay. That's not the same as being dismissed. They're actually addressing your concerns and providing you with education about typical development and where your child is falling. So GPs are absolutely able to do that. I'm not saying you have to see a speech pathologist just because you have speech concerns, but your GP does need to listen and address those concerns if they're not going to refer on. Just being told to wait and see is just not a good enough response. Clear plan. When will we refer? What is the information they're using to make that decision? And what are the next steps? So I'm going to talk more next week a little bit about one of the most common areas parents are told to wait and see, which is childhood ENT issues. So ear, nose and throat issues like recurrent ear infections, needing grommets or tube surgery, adenoids, hearing, sleep disorder, breathing, all of those ENT issues, because those impact on sleep and regulation and communication in young children. So I'm not going to be providing any medical advice, as always. What I will be trying to share is some patterns that you might want to be on the lookout for recognizing, helping you know what questions to ask, and help you feel more confident advocating if something's not sitting right. So it's going to progress everything I've talked about today, but really in that specific area of ENT issues, there'll be a little bit of education just to help parents understand what typical concerns might look like and what the next steps might be. I hope you come back next week to hear how that all goes. Thanks for listening today. Bye. Thanks so much for listening to Not Just Theories. I really appreciate you being here. If this episode resonated with you, the best way to support the show is to follow, leave us a rating or review, or just share this episode with someone else who you think might find it comforting or useful. I hope to see you back here soon.